Thank you. I look forward to working with you.
Thank you, Senator Stabenow. Senator Cassidy, who is always very helpful in working on these health issues. Senator Cassidy.
Thank you, Senator Wyden. Secretary Becerra, nice to have you.
Thank you.
Secretary Becerra, as you know, the U.S. District Court for the Eastern District of Texas recently ruled that the rebuttal presumption of a benchmark rate in the interim dispute resolution of the No Surprises Act was invalid. The judge ruled that this, quote, conflicts with the unambiguous terms of the act, end quote. Now, as you know, the majority of my colleagues and I have been who wrote this legislation, have been sending you letters before and after the issuance of this rule that it violated congressional intent, clearly violated the plain reading of the law, and violated the kind of delicate balance we have between all the stakeholders to get them to agree. So on behalf of the administration, I guess I'm asking, would you commit to accepting the will of Congress and the courts and finalize a rule promptly that does not include a rebuttable presumption of a benchmark in the IDR, but rather follows congressional intent? And when can we expect that rule?
Senator, thanks for your interest. By the way, thanks for your advocacy on this particular issue on No Surprises Act. We have put in place guidance. The CMS has put in place guidance that has made clear that we are updating our documents and other materials in light of the Texas decision. But it'd be difficult for me to comment more since we are still in the midst of that litigation.
May I ask, will you be appealing that decision or accepting it?
That's a decision that will be made working with the Department of Justice. I can't give you that answer right now, but what I can tell you is that we're continuing to work through that litigation as best we can.
And I'm sorry, do you accept what the judge says, that it clearly violated the unambiguous terms of the act?
Well, as I mentioned, we've updated our guidance. We're doing everything to make sure we stay compliant with the law, and we will continue to proceed forward. We are implementing other aspects of the No Surprises Act that were not implicated by the court's decision, and we'll move forward making the decision where to proceed on that particular litigation.
Then let me go on to Medicaid, and specifically outcomes. Maternal mortality continues to be abysmal. Medicaid pays for 60% of births in our nation. And there's an old public health maxim, that which is measured is addressed. Now, we have a way to measure outcomes in Medicaid. It's called TMSIS. But it's my understanding that the method by which that data is presented to CMS is non-standardized. And indeed, different data sets are presented by different states, and some PDF and some digital, et cetera. So I just gave the pregnancy outcomes, but I could give many others where Medicaid is not coming up to where it should. So the question is, what is CMS doing in order to kind of better standardize both the data that is collected and reported and how it is reported to make us better capable of viewing one state versus another?
Senator, you've touched on not a sensitive subject, but a subject that absolutely needs further attention. TMSIS is something that's been, as you know, in the progress for many, many years. We're trying to make as much progress as we can. We saw with COVID how important it was to have accurate data, and Medicaid is no different. We have to make sure we continue to work to ensure that the states are giving us the data we need so we can make decisions, and states can make decisions that make total sense. And so we look forward to working with you as we try to move forward with TMSIS and getting that taken care of. But as you know, moving these systems, these databases, into a different shell is difficult.
I accept that, but it could just be asking them to report the same issues. You know, if one state is doing this and no other state is doing that, then there's no way to have a comparator.
Yeah. And it's easy to ask. It's hard to get responses unless you have more than just a carrot to ask. And so we have tried. We learned that lesson with COVID, that some states have been very good about reporting data, even that data that they're not required to report. Other states have not. And it makes it difficult to make those full decisions, as you're mentioning.
So it sounds like this committee needs to give you some tools in order to address that.
We would love to work with you on that.
Sounds great. Next, I'm talking about mental health, several issues. One is the RAISE initiative, which is the coordinated specialty care, which Congress has given money for. When I look at my own state, however, only 2 of my cities have actually begun it. And again, just for context, this is a wraparound set of services so that when a young person has her first psychotic episode, those services are there so that that first is her last. But apparently it is just so difficult to coordinate the different agencies that apply this so that it's had limited effectiveness and limited reach. So my questions are, what steps is the administration taking to increase access to the coordinated specialty care? And how is the administration prioritizing programs that serve this population like Medicaid and SAMHSA to work better together in order to achieve more people being enrolled in coordinated specialty care?
Yeah, and Senator, you're raising one of the areas where it's clear that we need to do more because there has not been that type of coordination, whether in the public sector side of healthcare or in the private sector side. And what we're trying to do, and that's why the President's budget reflects that priority, is make sure that we give everyone the tools, not just our agencies, but the private sector the tools they need to make it happen. We also put some requirements out there so that we can ensure that we're actually providing the care that people need.
But the coordination, because apparently it's so discoordinated, it's just not happening. And like Pogo said, we've met the enemy and he is us.
Yeah, no, it's very disjointed. And trying to get all those different stakeholders to work together, they'll tell you it costs money. We'll say it's going to benefit them and actually save them money in the long run, but it's getting them there. And we might need to provide some incentives to help push this along a little faster.
Okay, I yield.
Mr. Secretary, just on this point that my colleague has made with respect to the Medicaid data on postpartum care, I'm very interested in working with you and the Senator on this because we ought to be getting better data on it because the need is so urgent. We ought to be able to wring every bit of value out of those healthcare dollars.
And Senator, with the proposal to extend postpartum care to 12 months, we should be able to collect not only more data, but better data for a longer period of time.
That was almost going to be my next sentence, but you said it much better. Okay, Catherine Cortez Masto.
Thank you, Mr. Chair. Secretary, it's great to see you. Thank you for joining us. First and foremost, let me just say this. I've got to thank you and the administration